Hi there, my name is Alexandra Parsons and I'm a second-year nursing student. The pre-operative stage is the period before a surgical procedure. Commonly, the pre-operative period begins with the first preparation of the patient for surgery and ends with the induction of the anaesthesia in the operating suite. There are many different areas for the registered nurse to work in, for example, pre-admissions, admissions, anaesthetics, scrub and scout, post-anaesthetic care unit, and the discharge of the patient. The most common types of the performed day surgery, according to the Australian Day Surgery Nurses Association, are arthroscopy, cytoscopy, dental, ear grommets, and cataract surgery. As discussed by Elise Bryant, patients suitably booked based on the surgeon's physical examination technique and psychosocial assessment, with the assistance of the peri-operative nurse to also perform an in-depth assessment and history. A more accurate and individualised discharge plan can be formulated. As a result, good communication between the care team enables a successful outcome. Furthermore, the peri-operative nurse can offer an increased sensitive, empathetic, and professional support role for the patient. Its demands to increase patient satisfaction and reduce anxiety. The patient should receive written instructions to take home regarding preparation, the procedure, and the post-operative care. Prior to surgery, the peri-operative nurse will visit the patient to speak with the patient to minimize any potential adverse events or psychosocial distress. Focus points of the initial and ongoing assessment, including the peri-operative checklist, include identity, detailed health history including baseline for vital signs, signs of infection and illness, surgical history, family history, medications, as some medications such as warfarin may need to be ceased prior to surgery, as well as pre-medications to be taken by the patient. Ensure the patient is fully aware of the procedure, the risks and benefits, and is able to relay information to the care team. Prior routine tests, additional belongings such as dentures, and also the recovery plan. Discharge planning should commence as soon as the patient assessment commences. Therefore, it is vital that the patient are given adequate information pre-operatively and are assessed to minimize any adverse events. A patient with uncontrolled diabetes or cardiac episodes may need further monitoring overnight. The pre-operative visits of an experienced peri-operative nurse allows a skilled conversation and assessment process with broad knowledge to discuss and answer knowledge deficits by the patient prior to going into the procedure room. The following documentation needs to be complete prior to the patient arriving in the operating suite: signed consent form, doctor's pre-operative orders, identification bands such as blood group, any required tests, pre-operative orders such as enemas or indwelling catheters. The nurse will then ensure and confirm with the patient and their family and or friends of the post-operative period in the recovery room. One study conducted by Swani et al. Found pain to be the most common problem following day surgery, as experienced by 86% of patients. As a result, increased recovery time, potential hard and falls risks, and decreased satisfaction may result. Therefore, it is important that the patients are educated by the peri- and post-operative nurse on the importance of analgesia and pain management post-procedure to ensure mobilization and recovery as a main point. This emphasizes the importance of education and a broad individualized patient assessment for successful procedure and recovery and the patient's satisfaction. Thank you.